Hello, my name is Sarah Moxon, and I am a registered nurse completing my bachelor's degree in nursing at Cal Poly Humboldt, and I am a certified nurse in an operating room. This poster, Enhancing Surgical Safety, describes my quality improvement project aimed to reduce surgical site infections, or SSIs, at a hospital by 20%. An SSI is an infection related to a surgical procedure that develops within 30 days or 90 days if there is an implant, such as in total joint replacement. What I have assessed is that SSI rates vary, but what I've found is that 66% of all SSIs in a hospital over the last year were urgent or emergent surgeries. Here's an example. If you are scheduled for a total knee replacement, you have time to prepare and lower your SSI risk. You may be asked to quit smoking. You may be asked to lose weight. If you're a diabetic, you may need to lower your A1C. You also have pre-op labs drawn. You are asked to bathe with a chlorhexidine soap to reduce the bacterial burden on your skin. And in the OR, there is strict traffic restrictions during surgery. This is all done to reduce your SSI risk. Because SSIs can cause disability and potentially death, patients need IV antibiotics, longer hospital stays, sometimes more surgery, and the cost is high to the healthcare system. Someone needing emergency surgery, say for a fractured hip, doesn't have time to do all of these things. For this quality improvement project, I looked at literature reviews for evidence-based interventions that can be applied for all surgical adult patients that had not yet been implemented at the hospital. The first one is a nasal decolonization with an alcohol-based antiseptic that takes only a minute to complete and is proven to reduce SSIs. The second is installing door counters on operating room doors to reduce operating room traffic, because the more times the doors open and the more people in the operating room increase the SSI risk. And the third intervention is to implement an SSI risk tool that would alert the patient's surgical team and post-op care team to the patient's individual risk for SSI for continued surveillance. Thank you for stopping by my poster.